Is it possible to perform limb lengthening? This is the most frequent asked questions to me. The answer is yes. Nowadays, limb lengthening surgery has become safer and easier thanks to the recent development in orthopedic surgical techniques. Can anyone get limb lengthening surgery? Anyone who has leg length discrepancy with or without limb deformity can do this surgery. But if it's going to be performed for cosmetic reasons, patients should have an age between 20 and 50. We prefer the individuals who are non-smokers, have good physical and mental health, and candidates without any chronic diseases or hormonal problems. For smokers, quitting to smoke is definitely obligatory. How is the surgery performed? Limb lengthening surgery is basically performed to lengthen the bone tissue. Long bones are cut at an appropriate level with a minimal invasive technique. Surrounding soft tissues are preserved carefully. We call that osteotomy. The edges of osteotomized bone are distracted 1 mm every day. While the patient is lengthening, the bone tissue tries to heal and fill this gap. The gradual lengthening is achieved during the distraction. When the desired bone length is achieved, the distraction is stopped and the bone is expected to heal completely. We basically divide all lengthening techniques in 3 groups. 1. Classical Ilizarov technique. This technique is an external technique. The circular frames are externally placed on the limb for lengthening. 2. LON, combined technique. It is also known as lengthening over nail. The external fixator and the internal nail are implanted into bone simultaneously. 3. Motorized nail method. This is known as an internal technique. There is no external fixator on the limb. There is only a special motorized intramedullary nail inside the bone. What is the combined technique? This technique is named combined because it's a combination of internal and external bone fixation methods. Combined technique basically provides the lengthening of the bone with unilateral external fixator over the intramedullary nail. After the lengthening is completed, the external fixator is removed and the nail is locked by the screws. So the time that patient carries the fixator is shortened and the internal nails becomes weight-bearing after removal. What is the motorized nail method? Motorized nails are most comfortable, less invasive and up-to-date technologies. There is no fixator outside, only an intramedullary nail implanted into the bones. Therefore, patient feels more comfortable and free to move. The risks of complications of internal method are less than the others. The motorized telescopic nail provides the lengthening with the help of an electronic remote controller. Patients can comfortably do the lengthening by themselves with this device. What are the safe limits for lengthening? Unfortunately, there are optimum safe limits in cosmetic lengthening. The most important factor is the adaptation capacity of surrounding soft tissues, such as nerves, vessels, tendons, and ligaments. According to the literature, it is reasonable to limit the maximum 8 cm for femurs and 6 cm for tibias in order to avoid complications. Higher lengthening rates should only be aimed to achieve within the second surgery. My major goal is to protect my patient's full functional capacity during lengthening. Functions come before lengthening rates. So, I never do or let the patient do anything which will put my patient's health at risk. My goal is not only to make them taller, but also to keep them healthy. How much time is needed for lengthening? The amount and the frequency of lengthening are closely related to healing potential of the bone tissue. Lengthening starts on the 9th day after surgery. average 1 mm lengthening is achieved per day. 8 cm lengthening approximately takes 2.5 or 3 months. Is limb lengthening a painful process? It is normal to feel tension in the limbs during lengthening. This feeling varies from person to person, but is certainly not an excessive pain. If the technique is applied correctly, the mild to moderate painkillers would be enough. The appropriate physical therapy program and early mobilization will reduce the need of painkillers. Extreme pain is often a sign of a complication or technical incompetence. When can I walk after surgery? On the first day after the operation, the patient can stand up and walk. The patient is not allowed to walk with a whole body weight. A walker is used to support the patient's walking. How long is the hospital stay? If everything goes well, patients stay in the hospital for 8 to 10 days after the surgery. During this period, the patient will get medical and physical therapy, regular dressing are done, and a brief introduction about the lengthening process is given to the patient. When can the patient return to normal life? The patients can return to their normal life within 6 months after the operation. The patient can walk and work in office. However, the patient will be allowed to return to sports after 9 months. It is recommended to return competitive sports after 1 year.